I did 2 rotations, one to Barcaldine, also known as Barkey, and the second one I went to was Emerald. They're both very different. So there's a place I worked at in Brisbane where the dentist would have to fly out, say 1 week every month, and for that week just treat patients out there. And it was quite interesting because basically within the month you'd be treating patients in very different environments. The patients out in those locations generally hadn't seen a dentist for quite a while, and they wanted to see a dentist because they hadn't seen a dentist for a while. They had significant dental problems. That would be gum disease, that have significant dental decay, that need a lot of work done, in other words. Yeah, so when you see them, you know that they won't be able to see a dentist for a while, so you try to book large appointments, get a lot of work done, and try to do the most for them that you can. Tend to be very appreciative because I haven't seen a dentist for a long time. With Metro Dentistry, I suppose, so patients have the opportunity to shop around, and a lot of patients are looking for cosmetic things, so it does change what they're after. So people out in rural areas just happy to get the pure basics because they've been waiting for so long for the pure basics, while people in the city, some of them want the pure basics, some of them want the cosmetic things, and ironically sometimes you'll come across patients who want the cosmetic side and completely ignore the pure basics. So they might want pretty white front teeth, and they've got all these other rampant problems that are happening in the back, and you get a bit worried about that sometimes, and it's harder to convey to them the importance of the pure basics and getting the teeth right in the first place when they just want pretty teeth. Yeah. If you're out in a rural area looking at a lot of dentures, taking out a lot of teeth, just fixing up a lot of bad things, I suppose, as opposed to here you'll get cases where people have teeth that they do want to make them look better. They're not, in some ways, you're trying to make their smile look a bit better, which it still helps because there is a psychological aspect to people's smiles. You're making them look better, they'll be happier with themselves. But yeah, that's pretty much all I can really say. It's different from that point of view. So they've got different motivators. They know, yeah, they can come back more routinely as well, and that changes things.